Thank you for joining Cancer Support Community Atlanta for this program. Please visit our website, cscatlanta.org, for a complete list of live and recorded events. We invite you to sign up for our newsletter to stay connected to all future programs.
Welcome everyone to this nutrition seminar on heart health presented by Kristin Cuculovksi, the Oncology Clinical Nutrition Coordinator for Northside Hospital Cancer Institute. Kristin provides these presentations for us every month on a particular nutrition topic that is important in oncology, so we are very grateful for her being here today. All right, without further ado, I think we'll go ahead and get started.
All right, thank you, Emily, and hello, everybody. Happy belated Valentine's Day. I hope everyone is having a good week, but like Emily said, my name's Kristin. I'm one of the registered dietitians at Northside Hospital, and our topic for this month is going to be how to eat for heart health. So February is Heart Health Awareness Month, all kinds of good American Heart Association things happening in February, which is always an exciting time. And we just want to draw attention to nutrition and eating because there are a lot of lifestyle things that you can do here. So I do like to give a little bit of a disclaimer at the beginning of these presentations. This is more of a general presentation for a lot of different people. I think there are 20-something people on here. So more individualized things or more one-on-one topics or questions that you have. We do have dietitians that are all throughout the Cancer Institute here at Northside, so you can always call your doctor's office and ask how to get in touch with a dietitian, and they should be able to send us a referral or at least let us know that you want to have that one-on-one time with us. If you go to a different cancer institute like Emory or Wellstar or Piedmont, they also have dietitians on staff and should be available to you. So definitely use your resources there when you can. But we will go ahead and get started here. All right, so our objectives for today, we're going to focus on determining what risk factors there are for heart disease, identifying parts of your balanced heart healthy diet that you can start incorporating or working towards, and then making goals to start to improve your health if you're not already heading in that direction. So just some food for thought about our heart. Does more physical work than any other muscle in your body. It is pumping all day long, all the time. So it's definitely very important for our survival. The average heart pumps 2,000 gallons of blood per day, or about 70 gallons per hour. So quite a lot of work going on there. And then in a 70-year lifetime, the average human heart beats more than 2.5 billion times. So again, it's not ever resting, hopefully, and it's always going to be working for you. So we just need to do our part to make sure that we're keeping it as healthy as we can through things that we're able to control. So just a little overview of heart disease. Heart disease is the #1 cause of death in the US for both men and women. And people of most racial and ethnic groups. So it's really affecting a wide variety of people. Most people might have to deal with heart disease at some point. And obviously COVID is up there too as far as cause of death now, but I think heart disease is still #1. There are two main things that we kind of focus on here. Heart attack would be a decreased blood flow to your heart area. So that top photo up there is a picture of the heart, and it's got a little blockage going on there. And then you can see that it's just a decreased flow to that area, leads to a heart attack. And then a stroke. So sometimes people, when they think of heart disease, they don't always think about their brain, but we have a lot of blood vessels that are going throughout your brain as well. And so strokes are a decreased blood flow to the brain for some reason. So again, it could be a clot of some kind. It could be a blood vessel that burst, different kinds, but again, it's just a decreased blood flow to the brain. So when you think about heart disease, you also have to think about all of the vessels. It's running throughout your whole body. So we want our hearts to be in tip-top shape to get all those things pumping and going where it's supposed to be. So some risk factors for heart disease. It's estimated that 80% or more of heart disease is preventable. So that's a pretty significant number of things that we can do maybe through lifestyle or factors that you can modify to make sure your heart is as healthy as possible. So things that we cannot change would be your age, your gender, your race, ethnicity, and family history of heart disease. See, there's a lot more things that we can actually change to help lower your risk factor for heart disease. So not smoking would be a big one. Your alcohol intake, the American Institute for Cancer Research recommends no alcohol. Sometimes people will quote the American Heart Association and their alcohol recommendations. We'll talk about that a little bit later, but if you don't drink alcohol, it's not recommended to start drinking alcohol for your heart health. Having a poor diet, weight, carrying excess weight, and then other chronic diseases can also lead to heart disease. So things like diabetes, having high blood pressure, having high cholesterol. So those are all try to control either through our diet and our lifestyle or with medication and medical management if needed. So we'll just go through a couple of these. Hypertension or high blood pressure. I'm sure you've heard of that before, but what affects the blood pressure? So a high sodium diet, you're always eat less sodium, have a low sodium diet, and we'll talk a little bit about that later on. But stress and anxiety can also cause blood pressure. So I normally have a low blood pressure or a normal blood pressure, but when I go to the doctor and I get my blood pressure taken, I'm a little bit stressed or a little bit anxious, and so it kind of creeps up a little bit. You'll hear it. Sometimes they'll call it white coat syndrome, where you're just a little bit anxious about being at the doctor, and so your blood pressure is up. So any kind of stress or anxiety could have an effect on your blood pressure. Caffeine intake can raise your blood pressure, and then also your water intake. So sometimes people are dehydrated and their blood pressure can get low because there's just not a lot of volume helping to push through your veins because you're not drinking enough water. High blood pressure can lead to stroke, heart attack, kidney failure, and congestive heart failure. So it's definitely something that you want to keep an eye on, that you want to make sure you're monitoring if your doctor has told you to monitor it, because it is something that we can control either with diet or medication or other interventions. And that way you're lowering your risk of developing some of these other more serious or more complicated diseases down the road. So a normal blood pressure here is going to be less than 120 over less than 80. Hypertension, your upper number, your systolic number is between 120 and 139. And then the lower number, the diastolic, would be between 80 and 89. A high blood pressure stage 1, so you can see they have different stages, are going to be 140 to 159, with a lower number between and 99. Stage 2, it's 160 or higher, over 100. And then you're considered to be in a hypertensive crisis where you need to go probably to the emergency room, or definitely at least call your doctor if it's going above 180 over 110. So definitely something to keep track of. The last time I went to the doctor, I did have like a pre-hypertension, almost stage 1 type situation, and they were like, oh, I'm sure it's just you're anxious or you're stressed or you're nervous about being here. But I went home and I bought a blood pressure cuff anyways just to check it out, and I do run very normal to low at home, so I felt much better about that. So it's just something that's easy to screen for when you're at home, so just being mindful of that. High cholesterol, this is another one of identifiable risk factors here, but your cholesterol can be affected by genetics. It can be affected by your diet. If you have a lot of saturated fat intake, a lot of trans fat intake, and high amounts of carbohydrate intake can lead to high cholesterol. So sometimes people only think about the cholesterol line on the food label, or foods that are high in cholesterol make your cholesterol high, but we actually know now that dietary cholesterol doesn't always lead to cholesterol numbers. It's saturated fat, trans fat, and having a lot of added sugars in our diet can lead to this high cholesterol. High cholesterol can lead to those blockages we saw in pictures a few slides ago that can lead to a heart attack or to a stroke. So this again is something that we want to keep an eye on for sure. So when you have your cholesterol taken at the doctor, you usually have a panel that's done, and these are the numbers that tend to pop out. Sometimes there could be more depending on what your doctor's testing for, but HDL is what we would call your good cholesterol. So this cholesterol should be 60 or higher would be ideal. If it's running between 40 and 59, that's okay, but you still have a little wiggle room to help increase that. And we'll talk about ways to do this as we get further in the presentation. And then if it's less than 40, then that puts you at a major risk factor for heart disease. So HDL, we definitely want to increase that to 60 or higher. And then the LDL number, that's going to be what we call your bad cholesterol. And I know we don't normally like to label things good and bad, but your bad cholesterol is what can lead to some of these blockages. And so you want to decrease this number or have it less than 100 would be optimal. So anything above that is not optimal, and we're trying to get it down. And then your triglycerides, or the fat that's floating around in your blood, is also part of your cholesterol panel. So your triglycerides can be impacted by your carbohydrate intake. So a lot of added sugars leads to an increased fat storage for your body, and it can also raise your triglycerides. Alcohol can also affect your triglycerides. So those are just some things that can alter those. Sometimes people, you know, several decades ago, everything was do a low fat diet, be on a low fat diet, help your triglycerides. But we know that fat isn't always what the triglycerides get affected by. A lot of it does come from our carbohydrate intake, which is usually a new topic for some people. But on your lab values, you want to see it less than 149 would be optimal. So anything above 149 is going to be not optimal. And then they do a calculation based on these three numbers, and you'll have your total cholesterol number, and we want that to be less than 200 is desirable. Anything above 200, not as desirable. All right, so on the nutrition facts label, these are going to be some things that we want to keep an eye out for when you're looking at products to purchase. So your saturated fat, for more healthy vibe, you want to pick low saturated fat items as often as you can. So that would be things that are less than 2 grams per serving. So you can see on this example over on the right-hand side, it says your total fat is, and then it breaks it down into saturated fat and trans fat. And so in this example, the saturated fat is 1 gram. So that would be considered a low saturated fat food. So this could be a good heart healthy option for us. The trans fat, you always want this to be 0. Most products are 0. It's very hard to find anything in the grocery store that has something like a number that's not 0. But with this, it's a little bit sneaky. You do have to check the ingredient list, because anything that's partially hydrogenated technically is a trans fat. And anything that's less than 0.5 grams, they don't have to put on the food label. They can list it as 0. So this could have a 0.4 gram of trans fat, but the food industry is allowed to put the 0 here. So that's why you always have to check the food label or the ingredient list too, because you want to make sure it doesn't have anything that says partially hydrogenated oil in it, because that is going to have some trans fat in it, and there's not any safe amount that has been determined for our health. So it's a very unhealthy option. So no more than 2,300 milligrams of sodium per day. So when you're looking at a food label, something that's low in sodium is going to be considered 140 milligrams of sodium or less per serving. This one's 160 grams, so it's not too far outside of that low sodium range. And you'll see things that have, 580 milligrams. So obviously, 160 doesn't seem so bad, but it also depends on what else you're eating throughout the day. So if this food over here on this food label happens to be your favorite food, there's obviously a way to help incorporate that into your life, as long as you're watching your sodium at some of your other meals as well. And then added sugars, we talk about this a lot for cancer, and limiting your added sugar intake. And so for women, it should be less than 25 grams per day of added sugar. And for men, it should be less than 37 grams per day of added sugar. So in this example over here, it's underneath the total carbohydrate line. So underneath that, you've got dietary fiber, you have sugars, and then you have added sugars. So added sugars is anything that's going to be added to a food that wasn't there originally. So if you got a yogurt may have naturally occurring sugar from the milk that it was made out of. Sorry, hold on. But if they added maybe some fruit or some of that like fruit syrup to the yogurt, then that food might have some added sugars to it. So in this example, there's only 1 gram of sugar and there's 0 grams of added sugar. So whatever sugar happens to be in this product is naturally occurring in the product. But added sugars is anything like your plain table sugar. It could be honey or molasses, or it could be fruit that's added to a product that it wasn't originally in that product. Sometimes juices, juice is going to have naturally occurring sugar in it because it came from a fruit, but sometimes they might add additional sugar in there to make it taste better. So you'll see a lot of juice and a lot of those products that say no added sugar. But when you flip over the food label, it's going to say sugar, 15 grams. It just doesn't have, they didn't add anything extra to it. It's just what's naturally occurring in the product. So the added sugar is really where we get into a pickle in the US, because added sugars, they're in all kinds of food. It's not just sweet food. Sometimes you'll flip over a bag of chips and it's going to have some added sugar and you're going to be like, where did that come from? So you just always have to check the food label and see what's going on and what's in the products that you're looking at there. So those are the big things that we look at here for heart health. There's also cholesterol. Obviously, I don't want to forget that either. It's also listed on there, but we'll talk a little bit more about that here soon. All right, so our saturated fat and our trans fat. We'll break those down and kind of what the difference is here. So saturated fat is found in animal products or animal foods. They're solid at room temperature. So you can think about a stick of butter. It's usually solid at room temperature. It came from an animal. You could think about like a steak that has a lot of marbling throughout it. That marbling, that fat that's in there is going to be a saturated fat. If you buy something like 2% or whole milk, even though you can't necessarily see it, the fat that's in those milks is a saturated fat. If you buy something that's a skim milk or a lower fat milk, they actually skim off or skim out that saturated fat, which is sometimes why people are like, oh, it's milk water. But it's just kind of taking out those solid things to help lower the saturated fat content. Skin on chicken is a saturated fat. Lard, coconut oil is also saturated fat. Your lower ground beef levels, like 80-20 ground chuck or ground beef, it has more fat, more white in it. That's the saturated fat there. That's why we always tell people to do more lean meats, or like a 93.7 or a 96.4 for their ground beef if they're getting that. Same's true with turkey, like ground turkey. Sometimes people, if you actually look at ground beef, like a very lean ground beef to a standard ground turkey, sometimes the ground beef has less saturated fat than that ground turkey because they grind up maybe some of the poultry skin and stuff in it just as a filler. So you just want to be cautious there. And then full fat cheeses are also going to be higher in saturated fat. So it's, again, not to say you can't add some of these things in from time to time. It's just you have to be mindful of what the rest of the day looks like, and just know that those saturated fat do add up throughout the day. And then your trans fat is a chemical change that occurs to create a trans fat. So it's usually something to help make a product more shelf stable, to last longer. They used to be much more popular than they are now that we know how bad they are for our overall health, but definitely our heart health. So examples would be the hydrogenated oils, and you'll typically find these in baked goods and items that have a really long shelf life, or fried foods. So again, if you're buying those things, you definitely want to check out the food label if you can and see what ingredients are in there, and look for things that say hydrogenated oil. And then as far as sodium, obviously we use this for flavoring. It's also used to help with preservation, and then a leavening agent and other cooking. A diet that's high in sodium can lead to increased or high blood pressure, which leads to hypertension or could be your hypertension. And then the American Heart Association recommends that people consume somewhere between 1,500 and 2,000 milligrams of sodium per day. And the average American is consuming approximately 3,400 to 4,000 milligrams per day, so about double what the recommendation is. And then just one small teaspoon of salt, like table salt, has 2,300 milligrams of sodium in it. So that's not a whole lot as far as volume goes. So always being mindful of salt, salted products. A lot of nuts are salted, chips are salted. Sometimes sodium is naturally occurring in foods, like chicken naturally has some sodium in it. So when you're thinking about adding flavors and things, that's why we always try to get people to use our salt-free or sodium-free as far as their herbs and spices go to help dress up the flavoring, just to help keep a handle on this salt intake. All right, added sugars. Sugar that, again, we talked about this a little bit, but sugar that's been added to the food for sweetness for some reason. So these added sugars can definitely lead to an elevated triglyceride number. So we definitely have to be mindful of that. And then reading the food label and the ingredient label to make sure that you're able to identify any sources of added sugars. So now they put added sugars on the food label, so it's pretty clear like how much is in there. But sometimes people get a little thrown off, or you might want to know what kind of sugar has been added to it. But like we talked about already, it could be listed as sugar, glucose, high fructose corn syrup, honey, agave nectar, just a fructose, just corn syrup by itself, brown sugar, maltose, dextrose, rice syrup. There's all kinds of things that can be listed under. So again, you can have some of these throughout the day. You just want to try to stick to that less than 25 for women and less than 37 grams for men. But some pretty standard examples would be your yogurts that have things that are added to them, your desserts, sweets, sugar sweetened beverages like your regular sodas, fruit juices, smoothies, chocolate milk, coffee that you're adding creamer or other things to that might have some added sugar, tea, crackers, cereals, dried fruits, condiments. They always find a way to sneak in some added sugar. So again, just being mindful that those things could be in some of the products that you're consuming. And then what about cholesterol? So eggs got a bad rap not that long ago. Again, it was kind of like when we were on that low-fat diet craze several decades ago. But cholesterol is necessary for our body to make different substances. And then it's also part of our cell membranes that help to keep our cells intact. But your vitamin D needs some cholesterol. Help with the production. A lot of your hormones need a little bit of cholesterol to help with their production. And then your bile, which you need bile to help digest your fats that you're consuming. So it's an important part of that bile as well. So the previous recommendations by the dietary guidelines for Americans was to consume less than 300 milligrams per day. But the new research indicates that dietary cholesterol is not directly associated with our cardiovascular risk. So if you already have high cholesterol, or it's part of a genetic kind of thing, you do still want to watch your dietary cholesterol intake, but you don't have to be as strict as we once were in our recommendations. But the diet cholesterol usually coexists with saturated fat in some way. So you just want to be cautious again with that saturated fat that's going to be on the food label, or in some of those naturally occurring products like your chicken and beef and fish and that kind of stuff. So that's, again, sometimes why we promote more of a plant-based diet and trying to really focus on getting a lot of foods from our vegetables and our fruits, because they don't have cholesterol in there. So instead of eliminating only the high cholesterol foods, it's much more important to focus on cutting back on those sources of the saturated fats and the trans fats. So we have to shift that mindset when we think about our heart health from, it's not just the high cholesterol foods that we have to worry about, it's the saturated fat and the trans fats too, and probably more importantly. So what can you do to start improving your heart health? So getting comfortable reading food labels would be a really great place to start if you're not already doing that. That way you can see how much saturated fat is in something, how much trans fat is in there, what's it looking like as far as the cholesterol goes, and then also those added sugars. Starting to lean more towards those fruits and vegetables on your plate. And we'll talk a little bit, we'll break some of the stuff down. If you are doing animal proteins, you want to choose those leaner cuts of protein. So again, we talked a little bit, like if you're going to make hamburgers, then you might consider getting like the 96.4 grade or a 93.7, something that's just got less fat in it. Again, same is true with the ground turkey. You want something that has more protein and less fat. Taking the skin off of any chicken that you cook. A lot of people eat chicken breast for that reason. Or skinless, boneless chicken breast. Fish is usually a pretty lean protein. And then the fattier fish that are out there are usually an unsaturated fat versus a fat. Eating high fiber foods is also very helpful. Drinking enough water, making sure that you're flushing your system out. Exercising helps with your heart health, and then decreasing your alcohol intake and stop smoking if you're currently smoking. So this is a healthy eating plate here. It's pretty simple. It comes from Harvard, but this is really how we try to set up our plate. And if you've been to another presentation of mine, you know I use a different plate that's got some food on it, but this one is also very nice. So about 1/4 of your plate should be a healthy protein down here in the yellow. So choosing something like fish, poultry, beans, and nuts. So those are going to be plant-based options of protein for you. And then focus on limiting red meat and cheeses and avoiding bacon, cold cuts, and other processed meats. And that goes along with the American Institute for Cancer Research's recommendations as well. So both good for your heart and reducing your risk of cancer recurrence, or somebody else reducing their risk of cancer in general. And then the other 1/4 of your plate from your protein will be a whole grain of some kind. And we like our whole grains because they're packed full of fiber. And fiber is going to be very important to help lower cholesterol and keep your cholesterol and your triglycerides in check. So there's all kinds of whole grain products out on the market now, but you can do whole wheat breads, whole grain pastas, brown rice. There's all kinds of wild rice, quinoa is very popular. A lot of those ancient grains that they call them are really making a comeback at the grocery store now. So there's all kinds of fun stuff that you can play around with, but also limiting refined grains. So trying to stay away from white rice, trying to stay away from white bread when you can. If you're going through a cancer journey, sometimes you have to have some of these foods if you're having a lot of GI issues, or maybe you just can't follow a high fiber diet. So if that's you, you know, you have a different journey. But as far as the general, what we're talking about today, you want to focus on those whole grains. And then the other 1/2 of your plate should come from some good vegetables and a little bit of fruit too. So your non-starchy vegetables, really what we like to put over in this green section. And that would be anything from zucchini, bell peppers, mushrooms, onions, asparagus, any of your greens, kale, collard greens, a salad of some kind that you could do, tomatoes. Those kind of foods would all go under your vegetable section. And then fruits, I think most of us know fruits. Our berries are the highest in your fiber. So they're a really nice one to include. Citrus, oranges, apples, you know, really whatever's in season, whatever you like to eat is going to be perfectly fine. And obviously it doesn't have to like actually go on the plate if the juice is going to run into something, but this is just to kind of give you a visual of what a balanced diet would look like. And then when you're adding your oils or your healthy fats in, choosing something like olive oil or canola oil is very helpful to help give you some of that healthy fat that's not saturated fat. And then it definitely doesn't have any trans fat in it either. And using something like an olive oil or canola oil also helps our body to absorb some of those vitamins and minerals out of the foods that you are eating once they get into your intestines. So don't be afraid of having some of these healthier fats with your meal time. And then of course, if you're doing beverages, trying to stay away from anything that's sugar sweetened, so regular, even juice you should limit. avoid if you can, but it's okay to have it every once in a while, or if that's just something that you like, you just have to balance it out throughout the day. But sticking to your water, tea, coffee with little to no sugar is what would be recommended here. Okay, so fiber. So I'm going to stop here and tell a small little story. So last June, in the middle of the pandemic, I had my annual physical and I had my blood work done, and I actually had very high cholesterol, which was embarrassing since I'm a dietitian and I should know better, but I just wasn't eating as well as I should have been eating just from the stress of working in a pandemic and being in healthcare, which I use it as an excuse sometimes, but I just wasn't eating well, and this was a huge wake-up call. So the average American eats somewhere between like 10 to 15 grams of fiber, which is probably what I was doing. And the current recommendation is to do anywhere from 25 to 35 grams of fiber per day. So talking to the nurse practitioner, and she was letting me know, what my cholesterol numbers were. It could be genetic because it's high and your dad has high cholesterol. And I said, no, I think that could be, but I really feel like it's the way that I've been eating and the lack of fiber that I've been getting. I said, can I have 3 months before you put me on a medication to see if I'm able to lower my cholesterol through some just better eating habits and exercise? So she said, yes, you have 3 months. And so I was able to drop my cholesterol by 40 points in 3 months, which is crazy. But the only two things that I really focused on was eating at least 25 to 30 grams of fiber per day, which really doesn't leave you a whole lot of room to eat other things. Twice a week. And so I did that pretty consistently for 3 months, and I was able to lower it by 40 points, my total cholesterol. So these things do really work, and they are very effective. It's not to say if you're already on medication that you'll be able to come off, but sometimes people will tell you that things are genetic, and you really have to evaluate what you are doing on a daily basis and see what might be contributing to some unhealthy habits that you have picked up or incorporated, and see if you can do something about it if you're motivated and want to do that. So it can be done. I am living proof. All the fiber all the time. It's been fun. It's fun to figure out ways of getting fiber and different foods that I like to eat, and just trying to be a little bit more adventurous. So use me as an example if you need a little bit of motivation, but your fiber is going to be found in your plant foods. So it's going to be in your whole grains, fruits, vegetables, beans, and legumes. A lot of your seeds and nuts also have fiber in them. So almonds are very high in fiber. Chia seeds are high in fiber. Flaxseed is high in fiber. So those things you're able to kind of incorporate throughout the day to help boost your fiber intake. And then fiber helps to lower that bad cholesterol, the LDL, and it improves our gut health. It improves our GI health. It promotes normal bowel movements, regular bowel movements. It helps to lower your blood sugar, to keep blood sugars in control. Even if you don't have diabetes, we do focus on making sure that our blood sugars don't spike and that they stay pretty consistent. And then fiber takes longer to break down in our stomach and to digest. So it helps us feel full longer, which is nice if you're trying to manage your weight or eat a little bit less. It just helps to keep you feeling satisfied, so you're not eating and snacking all throughout the day. There are two different types of fiber, and we want a variety of both. So your soluble fiber actually forms like a gel-like consistency that helps to bulk up your stool, helps to just give your stool a little bit more of a formed appearance, and it helps to evacuate things out of our GI system. And then insoluble fiber is more like the bulk or the roughage. It's indigestible fiber, so that also adds some bulk to your stool, but it also helps with transit time as it's going through your intestines to help get it rolling out of there. So again, you want to have a variety of both. You just don't lean towards one or the other. And a lot of foods that have fiber have a little bit of both in them. But soluble fiber examples are like apples, pears. They have both soluble and insoluble, but they have a lot of soluble fiber. Oatmeal is a soluble fiber. bananas, anything that you would eat, like if you were having diarrhea, to help alleviate that, is more of a soluble type fiber. And then insoluble would be like your carrots, your broccoli, your Brussels sprouts, your zucchini. Those are foods that your body just doesn't digest as well, the fiber portion of them. And so it creates that, that roughage and the bulk that is gonna keep you moving. Like I said, the current recommendation is anywhere from 25 to 35 grams of fiber per day. I'd like to challenge people to take a few days and see how much fiber you're eating on a daily basis, so you know what your baseline is. Mine was not great. And there have been times where I'm like, this meal had 0 grams of fiber. What could I do to make it better? Or what could I add to it? Or if I'm thinking about, you know, I want to make salmon tonight. Well, that's good. That's going to be my protein, but I really need to know what fiber am I going to put with my salmon. And so it's been very helpful to think about meal planning in that perspective of like, okay, well, I've got these leftovers, but there's no fiber, or there's only 1 gram of fiber. What else can I throw in my lunchbox to add some more fiber? So it could be an orange, it could be an apple, you know, it could be something very simple, but just being more mindful of which meals, what are your favorite foods that have fiber or don't have fiber, and how you can increase that fiber intake. So if you go on this journey of increasing your fiber intake, you also want to increase your water intake as well. So you want to make sure that you're giving your body enough water to help keep that fiber moving through your GI system. So if you get a little dehydrated or you're not drinking enough, sometimes this can make people constipated because it's not able to evacuate like it should. So just be mindful of that. As you increase your fiber, also increase your water. And it's usually recommended, like if you find that you're one of those 10 grams of fiber per day person, start with only increasing by like 5 grams of fiber per day for a few days to make sure your body kind of acclimates and your GI system isn't like, whoa, we went from 0 to 35 grams overnight, and it's just going to cause a lot of GI distress and give you some diarrhea or cramping, and it's just not going to be a pleasant experience. You want to really stair step it and just be cautious there. I'm very passionate about fiber. Okay, unsaturated fats, these are going to be your good fats. So this is stuff that's found in your olive oil, salmon, a lot of your nuts are healthy fats. And so these unsaturated fats also help to reduce your bad cholesterol or your LDL numbers, but they also help to increase your good cholesterol. So this is like a double whammy. So you're reducing the bad cholesterol, increasing the good cholesterol when you incorporate these foods. And sometimes on the food label, if you think back to the food label that we looked at earlier, it had saturated fat and trans fat listed, but sometimes on the food label, the food manufacturer will also include unsaturated fats on there, but it's not required. So if it doesn't have it on there, that doesn't mean that they're not in there. Just sometimes if somebody's, you know, maybe boasting about the fact that their product has these ingredients in there, they want to make sure that you know that they're in. So polyunsaturated fats would be like your omega-3 fatty acids or omega-6 fatty acids. That's the term that gets used a lot. But your omega-3s are your fatty fish, flax seeds, walnuts. And then your omega-6 would be like sunflower seeds, sunflower oil, soybean oil. And unsaturated fats, also a great choice. Olive oil, canola oil, peanut oil, avocados, nuts, and nut butter, olives are all under the monounsaturated fat umbrella. So these are great things to add in throughout the day, like to get those healthy fats. So throwing a little bit of avocado on a salad, having a handful of nuts for your snack, having fish a few times a week will help you to be able to incorporate these unsaturated fats that are going to be good to help with lowering your bad cholesterol and raising your good cholesterol. All right, so omega-3s, they are dubbed the best fats, if you will. They help to reduce inflammation, blood clotting, and your blood pressure. They're found in both plant foods and animal foods. And then the 3 main types of omega-3 fatty acids are EPA, DHA, and ALA. So sometimes, again, on a label, it might say high source of EPA. So now you know what that means. But examples of this would be your salmon, albacore tuna, sardines, walnuts, and flax seeds. All right, so some physical activity. I didn't even include physical activity when I was lowering my cholesterol because it was just a very busy time, but now I'm back to walking. But this is also going to help lower your cholesterol, your bad cholesterol, and just improve your heart health overall. So the current recommendation is to aim to get at least 150 minutes of moderate intensity physical activity per week. And that breaks down to about 30 minutes, 5 days per week. So that's not too bad. It's not too much. And moderate intensity is usually something that you can do where you can still carry on a conversation. So it could be walking with your neighbor or walking and talking to somebody on the phone, like you're a little bit out of breath, but you're still able to carry on that conversation. So walking, jogging, biking, playing tennis, starting small, it all counts. Maybe you can only do 5 minutes. Maybe you have a 15-minute lunch break or break in the morning that you can take a small loop around the parking lot to get in. You can really add those up throughout the day. It's all going to count. So if you haven't been physically active for years, you don't have to go out and run a marathon. It's all about those small steps, getting stuff in, just working towards these things. Again, you can space it through. You don't have to do the full 30-minute chunk all at one time. Add walking or standing breaks to limit the time that you're sitting. So they always say sitting is the new smoking. But we do want to make sure that we are getting up, moving around our circulation. Your heart is pumping. You're just, getting some good activity in there. My watch tells me every hour that I need to stand up if I haven't stood up. So sometimes you need a reminder, especially if you have very intense work that you're doing and you just forget to actually take a break and go out and just get your blood pumping a little bit. And then limiting your screen time to less than 2 hours per day, which you might be like, Kristin, I work at a computer all day. My boss will fire me if I'm on there less than 2 hours. Of course, this is like after work type thing. So when you're at home enjoying time, limiting it to less than 2 hours is what you want to shoot for, because if you're doing more than that, you're not going to have enough time to do all this physical activity and all the things that you need to do to be active. So just being mindful, and that's any time you're watching TV, you're scrolling on your phone, you're researching stuff online, just being mindful of that, because the longer screens, the harder it is for us to get up and moving and doing stuff. If you're currently smoking or using tobacco products, Northside has an amazing smoking cessation program. So smoking does put you at a higher risk for heart disease and stroke. So you can talk to your doctor about the program, and they can actually send a referral over to the smoking cessation program so you can get enrolled. But this is their phone number. This is their email if you're interested in doing that. Built to Quit. It's super fun. We do a little nutrition section for them during their, I can't remember how many weeks the class is, maybe 6 or 8 weeks. But yeah, it's a great support and very helpful to a lot of patients. And then this Friday, Emily might talk a little bit more about this, but heart health is so important to us here at Northside that they've actually started a cardio oncology program. And so this Friday, one of our cardiologists is going to be presenting on this new program and what it's going to entail. And I think I'll let you talk about that, Emily, and then we will jump on to questions.
Yes, thank you, Kristin. Yeah, like Kristin said, we are having this program this Friday at noon, speaking about the new cardio oncology program with Dr. Metapoli, as well as Dr. Cheryl Jones from Macon. And if you'd like to register for that program, you can go on our website, cscatlanta.org, to our virtual calendar, or also just email me at emily@cscatlanta.org, and I will get you signed up for that. But thank you, Kristin.
You're welcome. Do we have any questions?
We have had quite a few questions come in the chat box, so let me scroll up here to the first. There are many kinds of salt. Is there a salt that is healthier than others?
So it's really the sodium that you're looking for, the sodium chloride. The sodium is what has been linked to your heart health, or like lack of heart health, I guess. So things that do not contain sodium, I guess, would be the route to take. Even I assume you're talking about like sea salt or some of the different like Himalayan salts. They're all full of sodium still, even if they look pretty. they're still sodium chloride normally.
All right, thank you. How about my total cholesterol is always high, but my good cholesterol is always very good. So should I be concerned?
You'll have to ask your doctor if they're concerned. I don't know the rest of your history.
All right, is almond butter a better choice than peanut butter?
They're kind of similar. So again, what else is in there? So sometimes you can go and just like, they have those peanut machines where you can press peanuts into peanut butter and there's nothing added to them. So peanuts are perfectly fine and healthy. Sometimes if you think about some of the long of peanut butter, they do process them to stay solidified so that oil doesn't come up like on the top, and that can have a little bit of trans fat in there, even if it doesn't say trans fat on the label. So you just want to check the ingredient list. But almond butter is just a different kind of nut. It depends on what you think better is. Like, does it taste better? Do you like one over the other? You can get a natural peanut butter that does have the oil that comes up on top, just like almond butter typically does. See which one meets your needs best. It's more of a preference and kind of what you're looking for in there. But either is good.
All right, what about adding a fiber supplement to help?
Yes, you can do that. So sometimes with the fiber supplements, it may only be like one kind of fiber, and sometimes it can cause distress. Have like 7 or 9 grams of fiber. It only has like inulin as the fiber source in there, and that can cause some discomfort, like cramping, bloating, those kind of things. Your body just needs a little time to get used to it. But yeah, if you're always falling short or you're not able to eat enough of the fruits and vegetables and whole grains to get up to 25 to 35 grams of fiber, then yes, you may need a fiber supplement to help bridge that gap.
All right, any suggestions for substitute of sugar in tea or coffee? If you drink these items every day and need sweetening.
Yes, so I mean, you could use something like Splenda or stevia, like an artificial sweetener. Stevia is more of a natural sweetener. It's just been processed into like a white powder that comes from a plant that can be a sweetener. So as far as if you're looking for something that actually has a sugar, you know, whether it's table sugar or it's honey or agave, they're all added sugars at the end of the day. And that's how your body perceives them. They might have a little bit of a different nutrient profile, but you know, your body's still going to get 15 grams of sugar out of table sugar or 15 grams of sugar out of honey, depending on how much you're putting in there. So it's kind of your taste preference and however you feel about artificial sweeteners like a Splenda or a stevia. There's monk fruit, I think, is another one that's getting more popular out there.
Another question about sugar. Should you limit the amount of regular sugar that's not added you have in your diet? Oh, just should you limit the amount of regular sugar you have in your diet, and how much should you have?
It really depends on the person and what your height and weight is going to be. If you're male or female, like it's kind of hard for me to tell you exactly what it is. Usually those added sugars are going to be the ones that we really want to be focusing on the most, because they're the sneaky ones that sneak into our diet. If you're talking about like, how much sugar am I getting from fruit? You know, we're less concerned about that because you're also getting a lot of fiber and a lot of other health from it. But if it's just products or things that you're adding a lot of sugar to or already have a lot of sugar added to them, then that really builds up throughout the day if you're choosing those foods over and over. But sticking to that less than 25 grams of added sugar for women, less than 37 grams for men, you'll start to see if you're doing that, your overall sugar intake and carbohydrate intake is probably going to start to decline because you're being more conscious about what you are doing with that.
Is there a particular brand of fiber that is better?
I don't know that there's a particular brand. I mean, Metamucil is pretty popular. Like a psyllium fiber, you can read the food label, tends to be, or like where the ingredient is for fiber product. I'm sure there are store brands that are equivalent. But I don't know that there's one's better than the other. And sometimes you just have to try stuff and see how your body tolerates something. And if you're like, that did not sit well, then you may have to, one, give it a few days to see like if you just need time to acclimate, if you're not used to having a lot of fiber, and definitely working yourself up. So don't start at like the max dose that's on the label. But then if after, a week, you're like, I just don't feel good with this, you might have to try a different brand or a different kind to see how it goes.
All right, well, thank you so much. I think that's it for the questions. I did want to mention that our next nutrition seminar is going to be on Tuesday, March 15th, and the topic is going to be based on it being National Nutrition Month. And Kristin, did you want to get a little bit into the topic?
Yes, so this month's or this year's National Nutrition Month theme is celebrating a world of flavors. So we're just going to take a little bit of a deep dive into some of the different spices and ways of flavoring food, and maybe look at different cultures and what they do as far as their seasonings and stuff go, just to make it a little bit more fun and a different topic than we.
All right. So again, that topic is going to be on March 15th at noon. We hope you all will join us for that. We'll have that on our website soon where you can register. And thank you for joining us today. You guys have a wonderful rest of your Tuesday. And thank you, Kristin, again.
Thank you. Y'all have a good one.
Thank you for joining Cancer Support Community Atlanta for this program. If you're interested in other...
Is there a particular brand of fiber that is better?
I don't know that there's a particular brand. I mean, Metamucil is pretty popular. Like a psyllium fiber, you can read the food label, tends to be, or like where the ingredient is for fiber product. I'm sure there are store brands that are equivalent. But I don't know that there's one's better than the other. And sometimes you just have to try stuff and see how your body tolerates something. And if you're like, that did not sit well, then you may have to, one, give it a few days to see like if you just need time to acclimate, if you're not used to having a lot of fiber, and definitely working yourself up. So don't start at like the max dose that's on the label. But then if after, a week, you're like, I just don't feel good with this, you might have to try a different brand or a different kind to see how it goes.
All right, well, thank you so much. I think that's it for the questions. I did want to mention that our next nutrition seminar is going to be on Tuesday, March 15th, and the topic is going to be based on it being National Nutrition Month. And Kristin, did you want to get a little bit into the topic?
Yes, so this month's or this year's National Nutrition Month theme is celebrating a world of flavors. So we're just going to take a little bit of a deep dive into some of the different spices and ways of flavoring food, and maybe look at different cultures and what they do as far as their seasonings and stuff go, just to make it a little bit more fun and a different topic than we.
All right. So again, that topic is going to be on March 15th at noon. We hope you all will join us for that. We'll have that on our website soon where you can register. And thank you for joining us today. You guys have a wonderful rest of your Tuesday. And thank you, Kristin, again.
Thank you. Y'all have a good one.
Thank you for joining Cancer Support Community Atlanta for this program. If you're interested in other live or recorded programs, please visit the online program tab of our website, cscatlanta.org, or follow us on Facebook. We'll be sharing additional information on upcoming programs.